Your body runs on soil, air, water, and code. If the planet runs a fever, patients do too. This is Steve Systems. Today, we ask a blunt question. Can medicine keep you healthy if the earth is sick? Let's test that. Planetary health is simple to say, but hard to do. It means human health depends on thriving natural systems and fair human systems. My stance would be to treat the planet like a patient and the patient like a planet. Diagnose, intervene, monitor, learn fast. The field links the clinics, cities, farms, energy, and data. And our aim for this lesson is the highest standard of health and equity within the Earth's safe limits. Two tracks run together. Track 1, to repair the ecosystems so life support works. Track 2 is to reform human systems so benefits and burdens are shared. These are the compilation of graph from the organization showing the overall global percentages of the last 2 centuries. In 6 factors, you will see extreme poverty, democracy, basic education, vaccination, literacy, and child mortality. These 6 curves tell one story. In 2 centuries, extreme poverty fell, basic education and literacy spread, vaccination scaled, democracy widened, and child mortality collapsed. That is human flourishing at the planetary scale. It is also planetary health. Each gain depends on ecosystems, energy, and governance. Vaccines need cold chains and trust. Education and literacy raise adaptive capacity and lower risk. Democracy strengthens accountability for air, water, and land. There is a paradox. While these lines rise in the right direction, the same period pushed climate, biodiversity, and pollution toward danger. We improve the lives by drawing heavily on natural capital. The task now is the simple, state, and hard to do. Keep the human gains while shrinking the ecological footprint. Measure success as well being per unit carbon, water, and land. So these are the graphs given to us by Our World in Data, and I would like to acknowledge this Our World in Data in the future slides because we are going to use the latest trends and data by the scientists and different universities across the globe in supporting our data-driven education. Like again, this is a fungus in a forest. This is your bee in a flower helping for pollination. This is one of the Philippines' best marine ecosystem. We have the coral reefs and all the thriving fishes. This is the products of our ecosystems, food, agriculture. Also, one of the best places to buy and purchase fresh goods, produce, fish, meat, poultry, vegetables, anything you want is in the public market. This is an urban setup in Metro Manila. And this is the Banawi rice terraces in the Philippines. The Rockefeller Foundation has produced a significant contribution to environmental science, and one of which is planetary health impact. A decade of planetary health impact, a future of hope and action, dated February 24, 2025. The origin of this is from the 2015 Commission report to a movement in the Planetary Health Alliance. Today, there are more than 500 organizations and more than 80 countries who have action lanes for 2025. Research and policy impact, education and youth leadership, including campus ambassadors and the Next Generation Network, global gatherings like the Earth Day, PHAM 2025, the COP30, community action via regional hubs where there is a rationale that is escalating risks to health from climate and nature loss demand, coordinated cross-sector work, and also to call action in this particular hope and join to action. We're gonna participate in events, subscribe, and help drive the great transition through education, policy, storytelling, and research. The premise of planetary health says that the long-term human well-being depends on the well-being of Earth's living and non-living systems. Drake frames it as treating the planet's systems and our health as one interlinked whole, which draws on the Rockefeller Foundation Lancet work and the United Nations framing. I'm Steve, and this is Planetary Health in Environmental Science. You will see here the annual total carbon dioxide emissions by world region, and these are the following: Asia and other Pacific, China, India, Africa, Middle East, the Americas, the United States, Europe, and the EU 28. And this Carbon Dioxide Information Analysis Center is coming from the Global Carbon Project. Note that the statistical differences note the discrepancy between estimated global emissions and the sum of all national and international transport emissions. This is coming from Our World in Data. Planetary health recognizes the health of the planet as a system. Why now? Human activity is pushing our key Earth systems past safe limits. The health stakes show up through climate shocks, nature loss, water and food stress, and disease risks. What it is, a cross-disciplinary field in the last decade that studies how transforming nature feeds back into human health, with a lot of solutions that cut across policy, cities, and food and energy and care delivery. So, protecting health means staying within planetary boundaries while advancing equity. The agenda blends research, education, and governance so actions yield co-benefits for people and ecosystems. It's like a bigger umbrella for public health, global health, One Health, and this is the planetary health. According to Per Ugeli, that the patient Earth is sick. Global environmental disruptions can have serious consequences for human health. It's time for doctors to give a world diagnosis and advice on treatment. Planetary health is a research paradigm, a science for exceptional action, and a global movement. Its working definition is the health of human civilization and of the natural systems it depends on. It has an emerging discipline within 25 plus domains. Its precursors and early milestones, including during the 1970s to 1980s, environmental or holistic health roots, Friends of the Earth expands the World Health Organization's definition to include our ecological well-being. Lovelock coins planetary medicine in 1986 and later publishes Gaia, the practical science of planetary medicine in 2000. Frijeli said earlier that the patient Earth is sick. In 1993, the Terra or the Planetary Medicine curriculum was founded in the late 1990s. For consolidation, during 2014 to 2017, the Lancet calls for a planetary health movement to transform public health. Rockefeller Foundation Lancet Commission launches the concept in 2015. Planetary Health Alliance founded in December 2015, and the RF Economic Council at Oxford Martin School in 2017 with the inaugural issue of the Lancet Planetary Health in 2017. Planetary Health has promoted the EAT Lancet diet, or also known as the planetary diet or the planetarian diet. The PhD is a flexitarian diet consisting of plant-based foods, vegetables, fruits, whole grains, legumes, nuts, and unsaturated oils. It includes moderate amounts of fish, shellfish, poultry, dairy, and eggs. Red meat, including the beef, lamb, and pork, is included in small quantities. Processed meat, highly processed foods, added sugars, refined grains, and starchy vegetables are minimized. The planetary health diet can include a wide range of whole foods and cooking traditions. As shown here, we have the provincial ratatouille fish, Nigerian beans and spinach with plantain, Macedonian whole wheat bread with apricot jam, and the Korean gimbap. This is the Our World in Data Consumption of Animal Products in the EAT Lancet Diet 2017, where it shows the bar graph of the recommended intakes of animal products in the Eat Lancet diet, which are shown relative to average daily per capita supply by country. The EAT Lancet diet is a diet recommended to balance the goals of healthy nutrition and environmental sustainability for a global population. So the blue is for the dairy or the milk equivalents, the red is for red meat, the beef, lamb, and pork, the green is for the poultry, the bright red is for the eggs, and the orange is for the fish. So these are just the few countries that is being shown here in this bar graph. The US, Greece, Japan, the EAT Lancet, India, Indonesia, and one of the poorest countries across the globe is the Ethiopia that has 85 grams or 99 grams of consumption for the EAT Lancet diet. This is coming from the Food and Agriculture Organization of the UN, EAT Lancet Commissions. To transition to a planetary health diet, rich countries would need to reduce but not eliminate meat consumption. Poor countries such as Ethiopia, Indonesia, India could increase their meat consumption. This is the average per capita fruit intake versus the minimum recommended guidelines in 2022. Countries shown in blue have an average per capita intake below 200 grams per person per day. Countries in green are greater than 200 grams. This is coming from the National and World Health Organization, typically set a guideline of 200 grams per day. Again, the data source is from Food and Agriculture Organization of the UN 2024, Eurostat, OECD, and the World Bank in 2025. The countries shown in pink consume less fruit than recommended by the PhD and other dietary guidelines. Fruit is difficult to afford for people with low incomes. And these are the frameworks, declarations, and roadmaps from the year 2021 to 2024. The Planetary Health Education Framework has 5 domains for knowledge: values, practice, interconnection with nature, the Anthropocene in health, equity and justice, movement building, and systems thinking. The Sao Paulo Declaration in 2021 has shown the multi-stakeholder call for a great transition. The UN Stockholm Plus 50 report in 2022 on a healthy planet and shared prosperity. AFMC, or the Academic Health Institutions Declaration on Planetary Health in 2023, with 40 plus signatories, founded the development or the roadmaps for 2023 beyond. The Global Planetary Health Roadmap and Action Plan in 2024 includes the governance, education, business, and focus on communications. One of the research paradigms in agenda of planetary health is an expanded World Health Organization health frame to define linking human systems with safe environmental limits. Accordingly, the Anthropocene, or the era where humans have lived, and the planetary boundaries have formed the 9 boundaries. 2024 has an update where 6 exceeded and ocean acidification nearing threshold. Later on, I will show you these 9 boundaries that has been crossed and exceeded by the Commission. Governance and knowledge system reform identified as urgent. This is to integrate social, economic, environmental policy and to redefine prosperity around the quality of life and nature's integrity. The Royal Netherlands Academy report in 2023 has greater than 100 knowledge gaps, which is focusing on the need for an international, coordinated funding and academy networks. Our nutrition and diets, one of the issues and interventions for the planetary health, served as the levers and indicators for planetary diets and health. Also, with biodiversity loss, pollutants, climate change, and fuel use as health threats. Zoonotic risk from biodiversity destruction and land invasion, malaria dynamics, and the COVID-19 emergence pathways. Also, with the digital technology as a planetary health factor, the generative artificial intelligence, climate, biodiversity, and pollution impacts. With PHA, there is 470 plus member institutions with 20,000 plus subscribers. And there are 8 regional hubs across the globe: the Caribbean, East Africa, Europe, Japan, Latin America, Oceania, South and Southeast Asia, West Africa, and in 2022 there has been a Europe Hub meeting somewhere in Amsterdam. The Secretariat at Johns Hopkins University, since November of 2023, formed the Next Generation Network, where the Campus Ambassador Program failed pipelines to AMs, hubs, and some clinician networks. In the year 2017 until 2025, there has been hosts for the annual meetings like the Harvard, the Edinburgh, Stanford, Sao Paulo, which is virtual in 2021, Sunway, Malaysia, and in 2025, the Netherlands planned in Erasmus. Outputs is the Sao Paulo Declaration in 2021, the Kuala Lumpur Call to Action in 2024, and the Global Roadmap and Action Plan. To adjacent fields in response to public health, environmental health, eco health, One Health, international or global health, which focuses more on the population and equity, but historically light on Earth system constraints. The critic for this is the risk of totalizing health, and the debate continues. A major new scientific review, the Planetary Health Check 2025, shows that 7 of 9 planetary boundaries have now been exceeded. For the first time, this also includes the boundary for ocean acidification. This means that several of Earth's life supporting systems, risk crossing critical thresholds with severe consequences for both ecosystems and society. This is the 2025 update to the planetary boundaries licensed under CC BY and CND Azote for Stockholm Resilience Center based on analysis of Sashruski and Caesar in 2025. And you will see that in the graph. As mentioned, ocean acidification is the ongoing decrease in the pH level of the Earth's ocean. Between 1950 and 2020, the average pH of the ocean surface fell from approximately 8.15 to 8.05. Carbon dioxide emissions from human activities are the primary cause of ocean acidification, with atmospheric carbon dioxide levels exceeding 422 ppm as of 2024. The carbon dioxide from the atmosphere is absorbed primarily by the oceans, and this chemical reaction produces carbonic acid. This is the H2CO3, which dissociate into a bicarbonate ion and hydrogen ions. With the presence of free hydrogen ions, or the H+, it lowers the pH of the ocean, increasing the acidity. This does not mean that seawater is acidic yet. It is still alkaline with a pH higher than 8. And you will see the effects such as mollusks and corals, because these are marine calcifying organisms, and especially they are vulnerable because they rely on calcium carbonate to build their shells and their exoskeletons. Sage, or the medical Sage, has a review entitled Its Relevance in the Modern Era, a topical review. The review defines planetary health as the interdependence of human well-being and Earth systems, and argues that rapid environmental degradation and climate change are already harming health via pollution, extreme events, infectious diseases, and rising non-communicable burdens. It calls for a shift to sustainable, prevention-oriented healthcare and education aligned with the SDGs, based on a narrative scan of recent literature and gray sources. The authors press to embed planetary health competencies in curricula and to mobilize physicians, nurses, midwives, and community health workers as advocates who cut the sector's emission and lead climate positive action. They map research and policy priorities, such as the AI, or the machine learning for monitoring climate smart health systems, early warning and preparedness, and better governance and financing to close the implementation gap. The paper concludes that only coordinated education, clinical practice, research, and policy can mitigate the risks and secure health for future generations, while noting the limits of a narrative review. In this table, this is the key aspects of planetary health and its relevance in the modern era. By definition, its key drivers such as climate change, biodiversity loss, land degradation, pollution, unsustainable resource use, pop growth, and urbanization. Its impacts are increased incidence of infectious diseases, declining air quality and respiratory diseases, loss of biodiversity and ecosystem services, food and water insecurity, mental health issues related to environmental degradation, social and economic inequalities. The approach is including holistic perspective, emphasis on prevention and proactive measures to protect and restore the health of both human and natural systems, collaboration across sectors and disciplines to address the complex and interconnected challenges of planetary health. For action, to promote the sustainable development and sustainable consumption and production patterns, and also to mitigate climate change by reducing greenhouse gas emissions and transitioning to clean energy sources. By Table 2, the recommendations for promoting planetary health in the modern era. First is to promote sustainable lifestyles. Second is to invest in renewable energy resources. Third is to enhance environmental education. Fourth is to strengthen environmental policies. Fifth is to foster interdisciplinary collaboration. Sixth is to support sustainable and agriculture practices. Seventh, advocate for global cooperation. And number eight is to encourage research and innovation. AI here stands for artificial intelligence. ML stands for machine learning. By definition, algorithms that learn patterns from data to make predictions or decisions without being explicitly programmed. ML is a subset of AI. Deep learning is a subset of machine learning. Okay? So this aspect has an application of AI and ML and the role of healthcare professionals. In environmental monitoring, the AI-powered drones, for instance, has real-time monitoring of environmental parameters like water levels and biodiversity. This is the healthcare perspective is to apply domain knowledge to inform decision making and policy formulation for environmental conservation. For sustainable agriculture, there are predictive models, AI powered robots, AI based precision farming techniques, or machine learning algorithms to analyze the soil data and provide recommendations for optimal crop selection, planting patterns, and irrigation schedules. For healthcare professionals, we collaborate with AI or ML specialists to integrate technology into agricultural practices, especially if there is diseases among agricultural products or the transfer from animals to humans. AI-driven predictive models for habitat restoration and wildlife management is for the conservation and wildlife protection. This is to support wildlife health assessments and veterinary interventions with healthcare expertise. Again, for our listeners, ML or the machine learning methods are supervised, unsupervised, or reinforcement to support planetary health by forecasting climate and air quality risks, to mapping land use from satellite imagery and modeling disease spread. For public health management, again, it's the ML models to enhance disease diagnosis, treatment planning, and drug discovery. In contribution to healthcare, to contribute healthcare expertise to ensure accurate interpretation and implementation of AI or ML outputs in disease management. And lastly, for energy efficiency and climate change, there are AI-driven smart grids for efficient energy distribution and management. Healthcare uses AI systems to monitor and analyze health data related to energy use and climate change. Hopkins Bloomberg also has published a website entitled Healthy Ecosystem and Healthy Humans. This is informing us about the functions of biodiversity against zoonotic diseases. But there are still anthropogenic land changes, global travel, and climate warming that are dismantling that shield, illustrated by the current monkeypox surge. The article synthesizes evidences that deforestation, irrigation and dams, and rising temperatures expand vector ranges and spillover risks, noting that airborne pathogens sickens billions yearly and that thousands of viruses might jump species in coming decades. It explains the dilution effect. It's more of the diverse ecosystems lowering transmission because more hosts are poor reservoir, whereas the biodiversity loss elevates the risk, like the white-footed mice in Lyme endemic forests. The researchers are countering with enhanced surveillance, like robotic mosquito which traps plus genomic analysis, and community tick control trials which caught the ticks but didn't yet reduce human disease, underscoring knowledge gaps. So zoonosis, beyond it, altered ecosystem can boost non-zoonotic threats like schistosomiasis, yet targeted ecological fixes like to remove the invasive aquatic plants, reducing infections and delivering the co-benefits to reinforce the article's call to cut carbon, conserve biodiversity, and reduce the risk of long-distance movement of goods. This is the zoonosis and the possibilities for the zoonotic disease transmissions between human and wildlife, the Lyme disease, monkeypox, hantavirus, Ebola, and the SARS. Wildlife and livestock, rabies, West Nile virus, tuberculosis, anthrax, tularemia, plague, salmonellosis, avian influenza, and brucellosis. Between human and livestock, the bovine spongiform encephalopathy, E. coli, cowpox, and the Rift Valley fever. And to end our discussion about planetary health, these are just two questions or prompts that I would like to ask to all of you for better understanding of what's happening in our planet Earth. Where does your local health policy cross a planetary boundaries, as what the figure before mentioned about the 9 boundaries that has been crossed by human activities? And second is, which governance fix from the commission would most improve outcomes in your city? Our big idea in this lesson is your health and the planet's health are the same story. When air, water, soil, and climate are healthy, people are too. When they're not, the bodies pay the price. What goes wrong when there's a heat wave, which strains our hearts and kidneys, dirty air harms pregnancies in our lungs, food and water problems raise disease risk, and it's not an abstract, it's a clinical admissions and pharmacy lines. What to do? We fix the roots, not just the symptoms. For a cleaner energy and transport, nature in cities, safer food systems, and health rules that protect the most exposed. Those moves help the planet and cut illness at the same time. Treat Earth like a patient and patients like part of the Earth system. Thank you so much for listening. And again, this is Steve Systems. Thank you so much. And don't forget to follow and subscribe to my YouTube channel.